Welcome back to Healthy Living for Life. We are now going to talk about genetic testing and how a family medical history helps doctors with that testing. Joining us now are Jacqueline Haven, who is a certified genetic counselor, and Corbin Schwanke, who is a genetics lab supervisor. Both Jacqueline and Corbin work in the medical genetics department at Shodair Children's Hospital. And thanks to you both for being here with us this morning. Can you just start out by talking about how can genetics fit into providing a better care plan for a patient?
So genetics is really integral in all areas of medicine, and more so all the time. And so we found that we're really able to integrate well with providers from all different areas and with patients of all different ages. So.
Okay, great. And so how do doctors and other healthcare providers use genetic testing to either diagnose or pinpoint diseases?
So genetic testing looks for abnormalities in a person's DNA. And if those abnormalities occur in a gene that correlates with a patient's condition, doctors can use that information to either direct treatment for the patient or help diagnose other family members. And the family medical history really applies there because these genetic conditions are very variable. So people like Jacqueline talk to patients about what's going on in themselves and in their families, and then we can use the genetic testing results to help diagnose their conditions.
Why would a patient be sent to your genetics clinic?
Really for a number of reasons. So we see patients from all ages, from before birth to end of life, and for all different indications. So we see patients who maybe have a personal history of disease, maybe have a family history of disease. Commonly it's people who have a family history of cancer or maybe a diagnosis of cancer themselves. And we work with them to see if we can determine a genetic susceptibility to disease, and if we can find it, kind of what we can do differently to help them be healthier.
Okay, great. So can you build on that a little bit about how genetics then can help that patient?
Yes, so finding a genetic susceptibility to disease really alters medical management significantly. And so, for example, patients who have a susceptibility to breast cancer, because they have a genetic mutation, qualify for increased screenings like breast MRIs. They might qualify for medications. We would discuss surgical options. And so all of those things are possible then with that diagnosis. And then also importantly, we know that family members have up to a 50% risk of also being affected, and we can offer that testing to those family members as well.
Okay, so on that same vein, if someone knows that they are susceptible to a disease, can they bring their children in at a young age to get tested for some of those that they know is in their family history?
Sometimes. So it really depends on the disease itself. So for adult onset conditions like cancer or certain neurological conditions that don't present until adulthood, we do not recommend testing children or people under age 18 because we truly want people to make their own decision to pursue genetic testing or not. It's a very individual decision. And so if it is an adult onset condition, we do recommend waiting until they are an adult to pursue testing. If it's a condition that would affect a child and might have medical management consequences in childhood, we would certainly test children.
Okay. How accurate is genetic testing?
That's kind of a complicated question. Our ability to detect changes in DNA is highly accurate, up to 100% accurate. Determining what those changes actually mean in the context of a disease is much more complicated. Because when you consider that humans have roughly 20,000 total genes, one change in one gene is not a black and white. You will have this disorder and it will look like this. There are a lot of interactions between genes, and everyone has variation in their genes, even siblings. So even siblings with the same mutation in a gene might have very different disease presentations. And again, this is where our family history really plays into the diagnosis and the management of these patients.
What is a genetics counselor?
So genetic counselors are healthcare providers who work in a variety of settings. We all have advanced training in both human genetics and counseling. And for myself as a clinical genetic counselor, we really work within a healthcare team. So for myself personally, I work with a medical geneticist who's a MD, other genetic counselors, a psychologist, a nutritionist, the lab, very closely, and together we try to find answers for families. And the genetic counselor is often the person on the team who's working most closely with the family.
Okay. If someone wants to go in for those sort of services or for genetic testing, does health insurance cover those kind of services?
Yes, for the most part, genetic testing is covered depending on the condition, but just like any other medical situation, you always want to check beforehand to make sure your insurance company is going to cover the services, and your healthcare provider can help with that information as well.
Great. Is there financial assistance for those folks where maybe health insurance won't cover those costs?
Yes, several options. So state, federal funding is available. Funding through our hospital is available. And we really work with the family to find different funding sources. And so we never want patients or families to not pursue genetics due to cost. We can almost always find a resource for them to pursue testing.
Great. Who orders genetic testing? Is that something a primary care physician does, or does a patient make that decision?
Primary care providers can certainly order genetic testing, but we always encourage them to consult with us beforehand, because these are complex disorders, and oftentimes the test that a primary care provider may think is appropriate may not actually be the right way to go from the outset. So we always encourage and we welcome collaboration with the primary care providers.
Okay, we need to take a break here in just a few seconds, but really quick, can you just tell us about your program and how someone could be referred to you?
Yes, so we're a clinical and lab program. Our clinical team does clinics throughout the state of Montana. We also connect with patients via telemedicine from anywhere in the state of Montana. So we even connect from patients' homes. And then a referral could come from the provider or from the patient themselves. And all of that information is available on our website.
Awesome. Thank you so much, Jacqueline Corbin, for being here this morning. We do need to take a break, but really great information. Stay tuned. Up next, we're going to learn how to create a family medical history. We'll be right back after these messages. Stay with us.